All right, this is 8.4 psychotherapy. So your objective for today is students will be able to identify the different approaches to psychotherapy. Okay, so in order to be able to do that, we have to talk about psychotherapy versus biomedical therapy. So psychotherapy is going to be therapy with a psychologist, or counselor. And it's a focus on improving the self. Versus biomedical therapy. Biomedical therapy is going to be what we consider drug therapy, psychosurgery, or something else that's going to focus on genetics or physical being. Okay, so the first of the therapies that we're going to focus on is the psychodynamic psychoanalytic therapy. This is Freud, right? Psychoanalysis. So we're talking about the unconscious, the id, the ego, the superego. So what they're going to do, or what they're going to focus on, is the psychoanalysis approach is going to take a look at unconscious forces in childhood. They're going to use these types of therapies. So free association would be that you like a word association without any limitations, and the idea being to get into your unconscious. Dreams, they do dream analysis to try to determine what your dreams are telling you. And transference, and this is when you work with a therapist and you transfer your feelings onto your therapist. The evaluation of this therapy is, first of all, it's time consuming. It is expensive. And we're not really sure if it works. Okay, so behavior therapy is, again, remember, behavior is this idea that behavior is learned. So we're trying to unlearn whatever negative behavior we have taking place, or whatever negative psychological behavior we have taking place. So you're learning to eliminate the unwanted behaviors through rewards and punishments. One way to do this is what we call aversive conditioning, and this is where you pair a negative stimulus with the behavior. So if you're an alcoholic, you may take a medication that if you drink, it makes you violently ill. That would be aversive conditioning to try to get you to stop drinking alcohol. Systematic desensitization and flooding techniques are both what we call exposure therapy. Oops. So this is where we slowly expose somebody to something over a period of time, where we expose somebody to something over a period of time. Systematic desensitization is going to be a slow exposure to the anxiety-causing stimulus. And one way to do that is through virtual reality. So that way somebody doesn't have to actually experience, but they can experience it through virtual reality, which it triggers the same type of anxious feelings. Another type is what we call flooding, and this is where it is a quick exposure to the anxiety-causing stimulus. Meaning that instead of like slowly getting used to it, they just throw you right in, right? They flood you with it. Another type of behaviorism or behavior therapy that we've talked about before, but I just want to kind of re-hit it, is what we call the token economy. So this would be, you get small rewards for correct behavior that you can cash in for something larger. A lot of prison systems use this. You're on good behavior, you get some sort of small rewards that you can cash in for something bigger later on. The evaluation of behavior therapy is it is very effective for anxiety disorders. Phobias and compulsions. The one concern or one negative is that it does not focus on the inner self. So just kind of focusing on all these outer behaviors, not really maybe what the cause of those behaviors are. So the cognitive therapy, cognitive is the way you think, thought process. So it's how we focus on 3 parts. Thinking, there should be a comma here, so this is 1. Process, which is 2. And information, which is 3. A man by the name of Robert Ellis, who I believe is on your psychology yearbook, if not, we should probably add him, came up with what we call REBT, which is rational behavioral, we're just going to scribble that out for a second, team, sorry. Rational emotional behavioral therapy. And really what he said makes a lot of sense to people. You identify the self-defeating thoughts so your negative thought process, you identify it, and then you attempt to change it. Makes sense, right? So we call this action, beliefs, consequences. The evaluation. What we see this work for is we see this work for anxiety, depression, eating disorders, substance disorders, so addictions. And the one thing to know about cognitive therapies is most cognitive psychologists are very willing to combine additional treatment. So like, hey, let's talk about this and figure out your thought process, but let's also maybe give you some anti-anxiety medication to see if that doesn't help us until we can identify and change that behavior. Humanistic therapy. So humanistic is self-fulfillment. Insight therapy is so aware of why you're doing something, your motives. People call it client-centered or even people-centered. One type of client-centered or people-centered is what we call active listening. It's a very specific type of listening to engage with the person who's speaking. And then, of course, unconditional positive regard. One type or one aspect of humanistic therapy is what we call existential therapy. And one type of that is called Gestalt. So it's like a subcategory of this. And essentially what it says is that the responsibility falls on the individual. And the idea or the focus is to experience in the moment. So how can we make life in the moment better? And so what they might try to do is role play to resolve past conflicts. So that way people are able, with the goal being that people then are able to experience in the moment, right? One thing that this therapy really focuses on, though, is that the responsibility really falls on the individual to make the changes. One evaluation is when critics say that it's not very specific or precise. So there's not really like a set diagnosis. However, but the idea of growth really appeals to people. They kind of like this idea that they can change their thought process and that they're responsible for it. All right, so group therapy is exactly what it sounds like. You're going to be in therapy with a group. Family therapy is one type, and the goal behind this is to understand family dynamics. To do conflict resolution, because usually a lot of family issues come from some sort of conflict. Self-help therapy, one type. Self-help therapy is when you talk about similar problems. There's a lot of different types of self-help. One example would be AA, Alcoholics Anonymous. Evaluation is that it's extremely economical. So it tends to be accessible to more people, but it does lack individualization. Okay, so is therapy effective? Well, that's actually a really great question, right? Is this worth it? What we have found through meta-analysis, and we've seen this word before, this is not the first time this word has popped up, Meta-analysis is when you combine the conclusions of multiple studies together to come up with some sort of an evaluation. What we have found is that people are better off with therapy. It's really hard to measure this because what exactly are you measuring? And you're going to tend to be on what people feel or how people feel or self-reported. So it's not as easy as like, yes, it's effective, no, it's not effective. But what we can kind of say from all the data is that people tend to be better off overall with therapy. But Hans Eisnick came up, and again, he should probably be in your book if he's not, came up with this idea that has support, and it's called spontaneous remission. And this just means that you will eventually get better or go into remission, even without therapy. And this is true to some extent. We see this a lot with depression or depressive episodes that are not major depressive episodes. So if you had a sad event and you might be going through some depressive times for a little bit, the likelihood of you coming out of that is on your own is actually pretty high if there's no history or anything else to be concerned about. Now, if there's other things going on, that's something to be worried about. But for many people, if they just go through a depressive episode, which most people go through at least once in their lives, they'll tend to come out of that just naturally on their own. What we do know, though, is we can say that behavioral therapies, this is what they are good for. They are good. Smiley face. For bedwetting, phobias, compulsions, and marital problems. Cognitive therapy, this is what we're good at. Smiley face, the depression, and reducing the suicide risk. What we know, though, is those with less focused. So meaning that there's not a specific cause, right? If you just have general anxiety, depression, and there's nothing specifically causing it or triggering it, or you suffer from something like schizophrenia, therapy alone is not going to be effective for you. We do know that. We do know that you need more than just therapy. You need some sort of a biomedical, which we'll get into next. And that's it.